Welcome to Clinical Capsules, your go-to podcast and trusted source for quick, evidence-based insights from TRC Healthcare. For 4 decades, we've been keeping healthcare professionals at the forefront of drug information and medical knowledge. And now we're bringing these vital clinical updates right to your ears every second and fourth Tuesday, delivering practical, actionable takeaways in bite-sized episodes. Today, Assistant Editor and Clinical Pharmacist Gina Corley discusses how to treat hyperhidrosis or excessive sweating in an excerpt from our popular Pharmacy Essential Updates webinar series. With that, let's get started.
Now let's jump into how to treat hyperhidrosis or excessive sweating. There are different types of hyperhidrosis, and it can occur in different parts of the body. But the main type we're going to be focusing on is primary axillary hyperhidrosis, which is excessive sweating underneath the armpits. Our article highlights a drug called Sofpironium or Sofdra, which is a new topical agent approved for primary axillary hyperhidrosis. So today we're going to talk about all the options patients have to treat this condition and then figure out where Sofpironium is going to fit in. But first, let's take a step back and talk about what hyperhidrosis is. So, like I said, patients with hyperhidrosis have excessive sweating, usually in the armpits, palms, soles of the feet, or face. And this isn't just regular sweating, it's profuse sweating. Hyperhidrosis can have a significant impact on people's quality of life. It can lead to anxiety or depression and can even affect work and social life. So first, we want to consider any possible medications that could be causing excessive sweating. These can include antidepressants such as venlafaxine or fluoxetine, NSAIDs such as ibuprofen, ACEs and ARBs like enalapril, or even opioids like morphine. Usually, if it's due to medications, the sweating can occur all over. But most often, people have sweating limited to certain areas. So after ruling out meds, most patients will follow a stepwise approach. And the first step in that stepwise approach is antiperspirants. Antiperspirants have various aluminum salts and come in a variety of strengths, and they seem to work by plugging sweat glands to block sweat. Reassure patients that aluminum antiperspirants are safe, and there's not good evidence of any link with breast cancer or Alzheimer's. Any of these products can also be used with deodorants to help decrease or mask odor due to sweating. But make sure to apply the antiperspirant first and then deodorant after. Overall, antiperspirants are well tolerated, low cost, and can be applied to any affected area. They are usually effective for mild to moderate symptoms. So, with antiperspirants, we want to try OTCs first. And if this doesn't work, we'll go to prescription products. And intuitively, prescriptions might seem like they're more effective, but explain there's not good evidence that prescriptions work better than OTCs or that one aluminum salt or strength is more effective than the other. These products vary in their strengths, and prescription strengths are not necessarily higher than OTCs. So, for example, OTC products can come in clinical strength, which may have up to 20% aluminum. And the prescription products have more varying strengths. For example, Drysol has 20%, but prescription Xerac AC has 6.25%, which is less than many OTCs. And OTCs cost around $15 per bottle, and prescriptions cost around roughly $30 per bottle. So if you want, you can suggest trying a high-strength OTC first and then moving on to a prescription product. So we also want to help patients focus on proper antiperspirant application. Emphasize applying to dry skin once a day before bed. This is because people often sweat less at night, so it's easier for aluminum to get in and plug those sweat glands. Also, make sure patients know to wash the product off in the morning. Aluminum chloride can mix with water in sweat and form small amounts of hydrochloric acid, which can irritate skin. If this happens, we can suggest patients get an OTC hydrocortisone cream. So if antiperspirants aren't enough, there are a plethora of other options that patients can try. We have topical meds, we have injections, and we have orals that we can try. And the order that we choose these in will depend on patient preference, cost, side effects, etc. There's really no best option. So now let's take a look at each one of these things individually. First, we're going to talk about a new prescription drug called Sofpironium or Sofdra. This is used for excessive underarm sweating. Sofpironium is an anticholinergic, which is why it helps reduce sweating. It comes as a 50 ml bottle containing 12.45% Sofpironium gel. The bottle has a pump and applicator that patients use to apply the product. Patients should be instructed to apply one pump to each armpit once daily at bedtime. So that's 2 pumps of gel total. But there are things that patients need to keep in mind before applying. First, patients should avoid shaving their armpits at least 8 hours before applying Sofpironium. This helps to lessen skin irritation. Patients should also avoid bathing at least 30 minutes before and 8 hours after applying Sofpironium, so the product has enough time to penetrate the skin. Make sure the skin is completely dry when applying and wait 5 minutes for the gel to dry completely before getting dressed. So patients will probably wonder how well Sofpironium works and how much it costs. Sofpironium has been shown to benefit 1 in 6 patients over 6 weeks, but it costs about $1,000 per month, and insurance companies are not likely to pay. So expect prior auth if you get a prescription for this product. Now we're going to talk about Qbrexza or topical glycopyrronium. Like Sofpironium, glycopyrronium is also an anticholinergic. It comes as a box of 30 cloths containing glycopyrronium 2.4%. Patients should use 1 cloth for both underarms. They should wipe 1 time across each underarm once per day. About 1 in 3 patients see improvement after 4 weeks. So it appears to have better efficacy than Sofpironium, but it still costs about $650 per month. And now we're going to talk about practice pearls that apply to both Sofpironium and glycopyrronium. These can both cause systemic or whole body anticholinergic side effects, such as dry mouth, blurred vision, and possible urinary retention. And for that same reason, recommend avoiding these 2 drugs if patients are taking oral anticholinergics because of concerns about additive side effects. We want to avoid these drugs with CYP2D6 inhibitors such as bupropion for the same reason. These can also increase anticholinergic side effects. And we want to also remind patients to wash their hands after they use these products because we don't want patients to use them and then rub their eyes because this could increase the risk of blurred vision. Techs want to make sure to enter days supply correctly when entering prescriptions for Sofpironium and glycopyrronium. So 1 box of 30 glycopyrronium cloths will last 30 days, since patients use 1 cloth to wipe both underarms once per day. And 1 50 ml bottle of Sofpironium gel will also last 30 days, since each bottle contains roughly 60 pumps of gel, and patients will use 1 separate pump for each underarm. These drugs are both approved for patients 9 and up, so older children and adults can use them. But we are currently not recommending Sofpironium or glycopyrronium in pregnant patients since there's not enough data to assess fetal risk. Lastly, these products are flammable, so advise patients to keep away from heat and flame. For example, don't store near candles. So moving on, another option that we could possibly try would be Botox or botulinum toxin A. This is given as 50 units injected into each armpit, so 100 units total. It can have long-lasting effects up to several months, and most people respond well, but it's costly. For example, one 100-unit vial can cost around $650. Plus, injection site pain is common, and a lot of patients don't like needles. Another option that can be used is oral anticholinergics, such as oxybutynin or glycopyrrolate. Both of these drugs are used off-label to treat hyperhidrosis. They are some of the most affordable options since they have been around for a long time and should be covered by most insurance plans. These tend to work pretty well in terms of efficacy, but have the biggest risk for systemic side effects, so they are often discontinued because of this. Another downside with these is they may need to be dosed multiple times per day. For example, with immediate release oxybutynin and glycopyrrolate, patients may need to take these meds up to 2 to 3 times per day. But if they report that they keep forgetting to take a dose, they can try oxybutynin ER, which is only dosed once per day. So that sums up our overview of the meds for hyperhidrosis. To wrap this topic up, I want to show you our tech tutorial resource called Topically Applied Dosage Forms. It has more tips on dispensing topical meds such as topical Sofpironium or glycopyrronium correctly.
We hope you enjoyed and gained practical insights from listening to this presentation. Be sure to follow or subscribe, rate, and review this show on your favorite podcast app. Or find the show on YouTube by searching for TRC Healthcare or clicking the link in the show notes. While you're there, check out our other TRC podcasts like Medication Talk and Rumor vs. Truth. Also in the show notes, we've linked directly to a few of the excellent resources mentioned today, available to subscribers of Pharmacist Letter, Pharmacy Technician's Letter, or Prescriber Insights. On those websites, you'll also find a lot more evidence-based, concise, yet comprehensive resources on this and other medication therapy topics. If you aren't already a subscriber, don't miss out on these resources. Sign up today to stay ahead with trusted insights and tools. We are an industry-leading, non-biased source of information and continuing education. And if you're a student, good news. Students can access a free version of Pharmacist Letter. We've linked to that directly in the show notes as well. Check it out. Find out more about all of our product offerings at trchealthcare.com. You can also reach out to provide feedback or make suggestions by emailing us at contactus@trchealthcare.com. Thanks for listening to Clinical Capsules.